Officer Professor Paul Kelly is providing an update.
One of the deaths that happened overnight or yesterday was a 42-year-old man who was a crew member on the Artenia cruise ship, which is, as we speak, leaving Fremantle on its way to the Philippines. So that's by far our youngest person that has died in Australia from this disease, and a terrible tragedy for that man and his family. But it is a reminder for us that this is not just an old person's disease. We are all in this together for a reason, because it can affect any of us. And whilst it's true to say that the majority of cases, over 80%, are mild, some of them can be very severe. So we still have 55 people across Australia in intensive care right now. Some of those have been ventilated, some of them extremely sick. And now this young man who's passed away. So these are really strong reminders for us why we are taking this disease seriously, and why indeed the whole world is taking this pandemic seriously. We're continuing to concentrate on the way out of where we are now. Australia has done extremely well compared with the rest of the world up to this point, but it is not a time for us to decrease the measures that we have in place. We have, for example, been one of the major testing countries for COVID-19, and a recent paper published by the London School of Hygiene and Tropical Medicine, I'm an alumnus of that institution in London, showed that we are at the highest level in terms of case ascertainment and making sure that the cases that are out there are being found. We reached a milestone. We now have over 400,000 tests that have been documented, done here in Australia, and so again, just by sheer numbers, we're doing a lot of testing. But one of the challenges that was put back to the Australian Health Protection Committee from the National Cabinet on Thursday was for us to continue to look and to consider what our testing strategy should be into the future. So that's part of our surveillance plan that we're developing, and we had a discussion about that today at our Australian Health Protection Committee meeting with the other Chief Health Officers. I chaired that meeting today, and we discussed what that surveillance plan should look like, and particularly what should we be doing in terms of expanding testing now that we have that capability to do that right throughout Australia. As we see less cases coming to us, what we would say passively coming to us because they're sick, we call that passive surveillance. We want to see how we can actively go out into the community to find more cases if indeed they are there. And so that will require us to think about how we do, for example, sentinel surveillance, which might be doing laboratory testing in places where we don't know there's cases, to see if there indeed are some. It will lead us to consider what we would do in the case of outbreaks in high-risk settings. And so we're seeing a real example of that right now in northwest Tasmania, where there has been an association of a healthcare worker with 3 aged care facilities in northwest Tasmania. So in the last 24 hours, almost 500 tests have been done on all the residents and the staff of those facilities as part of the measures that are being done to control that outbreak in northwestern Tasmania. There are nurses that are travelling as we speak across Bass Strait to assist in that effort in relation to the aged care facilities, and particularly in relation to those staff of those facilities that have had to go into quarantine as a safety measure to protect that vulnerable group. I think so that's a key component of our strategy going forward. The other thing we discussed today at the Australian Health Protection Committee meeting was about our rapid response capability. How should we and how could we respond to things like what is occurring in northwestern Tasmania at the moment, the sort of response that went to assist to WA in relation to the cruise ship, other requests for assistance that may come into the future. How do we prioritise those things? How do we make sure that the right staff, equipment, and whatever else is necessary, laboratory capability would be another component of that, would be available, and how would we make sure that that is prioritised to the areas of greatest need on the basis of what may occur into the future as we look to release some of those social distancing measures. So that's the way forward. It's 4 weeks we have now that the Prime Minister has mentioned. We need to have those things in place, and we're working very strongly and collaboratively across Australia to achieve those milestones. So happy to take questions now.
Do you believe that it needs to be mandatory for all Australians to download it and use it in order to reach above 40%? Was that the Protection Committee's advice to government?
So I just want to be very clear about the app. There was some speculation about that yesterday. This is absolutely and totally voluntary. The Prime Minister has tweeted about that this morning as well, just to make that very clear. This is a voluntary addition to work that we already do as a routine in relation to public health measures. So the app would assist and could assist very strongly the case finding and contact tracing efforts, which are absolutely crucial for us to continue to flatten that curve. So we don't have an app now, so we don't have that to assist us. So a 1% uptake of the app would be an improvement. The more we have, the better that would be. But to make it very clear, this is a voluntary process.
Do you expect that many Australians will take up?
Well, I hope they do, and certainly I think there's a lot of benefit of having such an app. And to be very clear, it's only in relation to data that is required for contact tracing. It will only be given to the health officials in the particular state or public health unit who was involved with that contact tracing for that individual who was a case. There is no geolocation or anything like that on this app. It's only based on doing contact tracing and case finding in a very rapid and hopefully wider fashion to protect all of us. So if I was to be in contact with a case and I had that app on my phone and the person who was infectious had it on their phone, then I could be alerted to that fact even though I didn't perhaps know that person I was in close contact with.
Apps overseas that are similar haven't had a huge uptake, 20 to 25%. Are you looking to other countries to see what they've done and see how we can improve on it here?
Certainly, and in fact the app that we're looking to develop is based on the Singapore app, which has done exactly what I've described. They haven't had a huge uptake in Singapore, so whether we will match that or not remains to be seen, but it is a purely voluntary thing. It will be explained in more detail over the coming week as it's being developed, and we're committed to make that available as part of the protection of the Australian public, as well as something that could be of assistance to our public health authorities to do their work.
And just on the situation in Tasmania, do you believe that the health authorities are getting a handle on the situation there?
Oh, absolutely. I have full faith in the abilities of the Tasmanian health authorities. So Mark Beach there, the Chief Public Health Officer, is on the Australian Health Protection Committee. He has a great team that works with him. We've provided assistance from the national asset, which is known as the AUSMAT teams, and we've heard a lot about them in recent months. I believe Minister Hunt calls them the SAS of the health workforce, and indeed they are a rapidly deployable force that can be put in there. And so they're there on the ground, and as I mentioned, there are nurses on their way on the Spirit of Tasmania at the moment to assist with to relieve the aged care facilities.
You mentioned in your opening statement that with regards to testing, that you're also going out into the community to do testing. Can you sort of just elaborate on what that might look like?
So I think this is something that would be definitely guided. So I think we'd be doing the general principles. So we've been doing all the way along from the national picture. So from the Australian Health Protection Committee, and we have widened this task out to a group of experts who are very good at surveillance and very experienced in these matters. Because this is a new field in a way. Most infectious disease surveillance, as has happened up to now in relation to COVID-19, has relied on people who are going to seek treatment at a doctor doing a test, the test going to the laboratory, and that test result going into public health action, as I've described. What we're talking about here is something much broader. Trying to find cases that wouldn't necessarily come to hospital, because we know that people that are mildly sick, they may not come to hospital or to their general practice or to one of the COVID clinics necessarily to seek treatment. They may not recognise the signs as being this particular illness. They may not have symptoms at all, in fact, but still be infectious. And so we're at that stage now of the epidemic in Australia where we need to take those ones much more seriously than we were when we were seeing hundreds of cases every day, and we were definitely concentrating on that side. So this is a way of getting out into the community and doing, essentially offering relatively random testing potentially for people in high-risk situations, for example. I know in other countries they've done testing of supermarket employees, for example, people that are at risk insofar as they have close contact with many people in a day. And those results are only just been done, so I'm not sure what the results are yet, that particular testing. But there's an example of thinking of a group that might be able to show that there is a case when we didn't see it, or to assure us that there are no cases. And so both of those pieces of information are obviously very vital in our response.
I just have one final question. Nursing homes say that they're struggling to get their hands on enough protective equipment. They don't have enough funding for extra staff to deal with this quarantine situation. Is it time to reassess that?
So certainly we're concerned about aged care facilities because they house our most vulnerable population in terms of this disease, and so we know that older people and those with chronic diseases are at a higher risk of getting severe COVID-19, in which case we need to do everything we can to protect them, and including protecting the workforce. We've found in the relatively few outbreaks we've had so far in aged care facilities that it can spread very quickly, including to the workforce. So we must protect our workforce as best we can. So we are in a much better position in terms of personal protective equipment than we were even a few weeks ago. There'll be more announcements about that in coming days. But we certainly do have much more protective equipment than we previously had, and that is available to the aged care facilities as it is to our frontline health workers as well. Okay, thanks very much.